How do DBT dialectics resolve inner conflict in bipolar disorder? Imagine feeling like you're caught between two powerful forces inside you, each pulling you in different directions. That's often what people with bipolar disorder experience: intense mood swings and conflicting emotions. Dialectical Behavior Therapy, or DBT, offers a way to help manage this inner chaos by teaching skills that balance acceptance and change. Originally created for borderline personality disorder, DBT has been adapted to help with bipolar disorder because it focuses on emotional regulation, mindfulness, distress tolerance, and interpersonal skills. These tools help individuals handle their feelings more effectively and reduce impulsive behaviors. Inner conflict in bipolar disorder usually comes from the clash between feeling elated and energetic during mania and feeling hopeless or exhausted during depression. People may struggle with impulsivity during manic episodes, acting without thinking, and then feel guilty or overwhelmed afterward. This push and pull can cause a lot of distress and make it hard to stay stable. DBT approaches this by encouraging a mindset of dialectics, which means recognizing that opposing ideas can both be true at the same time. For example, accepting oneself as they are while still wanting to grow and change. This helps reduce the feeling of being stuck between extremes. The core of DBT is mindfulness. It teaches people to observe their thoughts and feelings without judging them. For someone with bipolar disorder, this means noticing mood shifts early on without reacting impulsively. By becoming more aware of emotional triggers, they can create space to choose how to respond instead of automatically acting out their feelings. This awareness is key to breaking the cycle of escalation during mood episodes. Emotion regulation skills are also vital. They help individuals identify their emotions, understand what's causing them, and learn ways to manage them. Recognizing early signs of mood changes allows for proactive steps to stabilize mood before episodes become severe. While medication is often necessary for bipolar disorder, DBT skills can support medication treatment by helping manage emotional responses and reduce the severity of mood swings. Distress tolerance skills are especially useful during manic or hypomanic phases when urges to overspend, take risks, or use substances are strong. DBT teaches healthy ways to cope with these urges, like distraction techniques or self-soothing activities. This reduces inner conflict between the desire to act impulsively and the understanding that such actions could be harmful. It helps individuals stay grounded and avoid behaviors that might worsen their condition. Interpersonal effectiveness skills help improve communication and boundaries with others. When mood swings affect relationships, conflicts can increase inner turmoil. Learning to express needs clearly and set boundaries can foster better relationships and reduce feelings of isolation or frustration. This sense of connection and control can contribute to greater emotional stability. Research supports the idea that DBT can make a real difference for people with bipolar disorder. Studies show that when combined with medication, DBT can lessen the severity of manic episodes and sometimes depressive symptoms. It's also been linked to reductions in suicidal thoughts and behaviors, which are important concerns in bipolar disorder. However, it's important to remember that DBT is not a cure on its own. It works best when part of a comprehensive treatment plan that includes medication and ongoing professional support. The skills learned in DBT take time and practice. Consistency is key to seeing benefits. It's also essential to work with trained mental health professionals who can guide and support this process. While DBT helps manage emotional conflicts and promote stability, it's not a replacement for medical treatment. Always consult healthcare providers for personalized advice and treatment options. In essence, DBT dialectics help resolve inner conflict in bipolar disorder by teaching people to accept their emotional experiences while also working toward change. It encourages mindfulness, emotional regulation, distress tolerance, and healthy relationships, all of which contribute to a more balanced and manageable life. With patience and support, These skills can lead to greater emotional stability, fewer harmful behaviors, and a stronger sense of control over one's mood and actions. Remember, every person's journey is unique, so working closely with healthcare professionals is the best way to find what works best for each individual.